Hi everyone, and welcome back to the Living Well with Schizophrenia YouTube channel. In today's episode, we're going to be chatting with a psychiatrist by the name of Dr. Ashley Weiss about tips that she has for a successful psychiatry appointment. And so I'm really looking forward to seeing what kind of insight she has and what she kind of looks for in terms of interacting with a patient in terms of promoting a successful psychiatry appointment. But first, if you are interested in helping with the creation of videos like this one, please make sure to check out the link to our Patreon page in the description below. We are working really hard to keep building resources for you all that hopefully are valuable, and so if you want to help support the creation of these videos, please check out the Patreon page. Any support is appreciated. Thank you. So hi everyone. I'm here today with Dr. Ashley Weiss. She is a psychiatrist based out of New Orleans, and she works out of a clinic serving, I think it's youth, is that correct?
Mm-hmm.
Yeah,
Yes.
okay. So if you would like to share a little bit more about your role at the clinic and the demographic that you work with and whatnot, that would be great.
I'm Ashley Weiss, and I founded and still run the Early Psychosis Intervention Clinic in New Orleans. We call it Epic NOLA. Usually people from New Orleans will say NOLA to refer to New Orleans, Louisiana. So we primarily see young people. Most of the people that come to us are between 15 and 25 years old after first experiencing psychosis. So we have we've grown a lot. We're almost 5 years old, and we have an amazing team. So it's myself. I'm a child adolescent psychiatrist by training. So I have a partner that also is a child psychiatrist. We have resident psychiatrists, child adolescent psychiatry fellows that work with us. And we also have social workers, licensed professional counselors, and community engagement specialists, peer support specialists. There's a lot of people that make up this amazing group at Epic NOLA.
Great. It sounds like a really great resource for people. So today we're going to be talking about any tips that you have for individuals who are going to a psychiatrist. So any tips that you have for like a successful psychiatry appointment. So we talk a lot on the channel about tips that we have that we've collected over the years, but I think it'd be really, really great to get your perspective as a psychiatrist about what someone can do or work with their psychiatrist on in order to be the most successful in a psychiatrist appointment. So yeah, what are your tips?
So first off, I love my job. And I think that my primary goal, or what I think is most important in the beginning, is establishing kind of a partnership. So I think I'm a little bit biased because I'm a child adolescent psychiatrist at heart, but that's also, I think, led me to feel really comfortable with being a little bit more casual and, focusing on just getting to know someone, and part of my training and fellowship was getting on the floor and playing with 5-year-olds. So I feel pretty comfortable, not talking immediately about medicine initially, but just wanting to get to know someone before we kind of delve into some of the more difficult things to talk about. So I think from the other side, looking for someone that you feel comfortable with, and it's okay if it's not a great fit. So, in the beginning, paying attention to how you feel with the person. It's not going to be that it's a super comfortable, interaction at first, and it might take a couple appointments to get used to someone. But if you are finding yourself not used to someone and not really kind of moving forward and feeling comfortable, that might be a signal that it might not be a good fit. It's a little bit different than working with a psychotherapist, where sometimes the good the not feeling of a good fit might be a sign that you need to stick with that person to work through something a little bit deeper. But I think from the medication standpoint, which is primarily what someone's going to be dealing with their psychiatrist, having a sense of comfort with them is very important. And so kind of paying attention to your own comfort, with your doctor. Another tip would be asking a lot of questions. I think my visits are about, an hour to an hour and a half initially, and then 30 minutes at least. Every time I see someone, I often feel very curious about what's happened since I saw them last. And so I always encourage people to, if they have a question about a medicine, if they saw a commercial that scared them, if they had a family member say something negative about their medicine and it made them feel like, to not note all these things down so we can talk about it, so that we can kind of talk about decisions together along the way, because it's really hard for me to do my job if I don't get any information.
Right. And, I think a lot of people have a hard time, going to see the psychiatrist can be kind of a stressful thing for a lot of people. And so they kind of just go in and forget all this stuff. So do you find it helpful for the patient to kind of write down all these questions beforehand and then come to you with them?
I have several patients where I know that if we haven't gone through the list at that point, I have to, in my mind, make time for it because I know it's coming. So we might be talking and, catching up just about world stuff, world events. And then I'm like, oh, shoot, I know that this person definitely has a list and we have to make time to get through the list. That's helpful even for me with my own doctor visits. And I think, I work with a group of people that might be on medicine for the first time in their lives. Most of my patients are on medicines, and medicines that are intense medicines. So I know that there's going to be adjustments, and I know that there are going to be feelings about it. So whatever way can make you feel comfortable to express all of to express your experience with the medicine, more so than just, are you having nausea? Are you having headaches? Are you having something, the kind of run of the mill stuff? But are you feeling embarrassed about taking it? Is your mom driving you wild because she asks you every moment of the day if you're taking it? I need to know about your experience with this medicine in order to help make changes, make adjustments.
Mm-hmm. That's interesting because, I think a lot of people feel a little bit intimidated by their psychiatrist in terms of needing to fit a certain experience of the medication that they're on or whatnot. And so I think that it's a good reminder to be no, your experience is going to be different, and your psychiatrist wants to hear about your experience, not necessarily what you should be experiencing on a particular medication or whatnot, but that you really want to understand their experience of it is really good to hear.
Yeah, and I think that goes back to the number one tip. If you feel like that's not happening, and that the doctor is not interested in hearing about that, then I don't find that I don't want to. They should be interested in sort of the complexities of taking medication, especially taking antipsychotic medication, mood stabilization medication. I think it's incredibly important to have someone that's interested and that spends time with patients. And a lot of, I see my patients pretty frequently. Once things are stable and kind of heading in the right direction, I see people monthly, usually for a couple of years. And they'll sometimes ask why. And even if they may be they're like, I'm doing well, I have nothing really to say to you, that it's helpful for us to actually sort of like link together maybe things that I've noticed that have improved with medicine, maybe just in communication, to maybe point out some of the subtle improvements that maybe I'm potentially seeing, to discuss with my patient if they're able to notice the same thing, or if they even thought about that, so that they can maybe have, more, it's like a deeper knowledge of maybe what some of the goals are with medicines than just like the big ticket items, like voices are quieter. Okay. I want to know about a lot of other things that are going on. And I also tell people from the beginning that, the more that I get to know you, and as you're like doing life and getting better, and then we're able to sort of then retrospectively look back to identify subtle changes that might happen, such that maybe we're starting to head in the other direction. I have a lot of people that will come in at of an amazing young woman that I have seen now for 3 years, and we're doing everything by Zoom now, and she's in, leaves work to go sit and chat, and she's like, there's just this subtle feeling that I get when I'm hearing, a certain TV show that's on, it kind of gets stuck in my head, and I start to wonder. I mean, it's just very subtle shift that she's noticed, and she was wanting to, kind of get my thoughts on if it's something that needs to be adjusted in her medicines. But that's only happened because we've really tried to identify very early, I don't want to say like early warning signs, but early changes for her that could mean that maybe her symptoms were increasing. And I was like it made me so happy that she in her mind is like taking note of herself and her different experiences, and wants to keep me in the loop. And I encourage that from the beginning. So I encourage patients like to think about those things, and hopefully feeling comfortable enough to be able to talk about that with your psychiatrist is incredibly important. So keeping those, I think, potentially asking for higher frequency of appointments. If it seems like they're like, oh, I'll see you every 3 months. I don't know about that. Like, it depends on when. And keeping appointments even when you're feeling good, because the feeling good part is helpful for us as docs to see how, to see what healthy and living well looks like.
Yeah.
Then, it helps us to be like, hey, I notice that you're really struggling with putting your thoughts together in this visit right now, because I know and I've seen and I've been with you when you were feeling, at your best.
Yeah.
So I'm just wondering if you notice this, or wondering what this is about.
Yeah. So it's important for you to show your doctor the full spectrum of the symptoms that you exhibit, or the lack of symptoms that you exhibit.
Yes.
Mm-hmm.
Doctors are not always interested in just when things are wrong.
Yeah.
We actually sometimes really love seeing when people are doing well.
Yeah. So are there any other tips? Those were all really helpful and really great.
Bringing your medicines in.
Okay.
Like physically bringing them in. Not that I'm pill counting or anything like that, but just it's confusing to, like, especially now when pharmacies will automatically refill meds.
Yeah.
And they'll automatically send, we have several home delivery pharmacies, and they automatically send meds when we might have made a change. So people are just sometimes get confused about what they're actually supposed to be taking. So I'm like, I want to see them so I can be like, and I'll, write on them. Not doing this anymore.
That is helpful. Like, I think I'm going to take that tip and like bring my meds to my psychiatrist, because the pharmacy fills it automatically now, and I get kind of inundated with too many meds. And that's a problem.
Yeah. Especially when, the directions might be a little bit different. Because in the directions, I'll usually say, like, start with a half a tablet for 7 days. And they might, maybe I put one refill, which is my problem. I should not put a refill on that prescription. But then or they'll pay the patient will call and request a refill, and I'll say yes, but it'll be that one with those different directions.
Right.
I'm like, that was just to start. So managing medicines is complicated, and I think most of us want to help make it easier and not make it more of like a something else like difficult to manage. But yes, bringing in pill bottles and not just keeping them. I have one person that keeps them. It's like brought in this sack of things. It was from hospitalizations and I was like, we just need to get rid of these because
I think a lot of people have that bag. I have that bag of medicines that I try to put aside if I'm not on anymore and I need to do something with them. I need to take them to my psychiatrist or the pharmacy or something. But I think a lot of people do have that bag just because of, all the different kinds of meds you can have been prescribed or hospitalizations or that kind of thing. So, yeah.
Complicated.
So one tip that we've kind of given is to have someone that you trust to come to an appointment with you, to kind of be a second set of ears and a second, just to take in information on your behalf as well, especially when you're not doing as well, so that maybe you don't always remember everything your psychiatrist talks about or everything you don't remember all the things that you need to talk to your psychiatrist about. So what do you think about that? Are you open to that?
Yes. So, and I definitely, I think that there's like a ebb and flow in that. And like in the beginning, it seems like we definitely have, people coming in, if it's their partner or if it's a family member, to kind of help the situation, help remember things. And then I sometimes, divide up the appointment so that I can have them alone just in case, especially if there's I'm sensing any tension between them,
Right.
Wanting to have some alone time, but definitely having someone that's kind of your identified person that can have, that can help you out, especially like remembering details and things like this. And yeah, so we definitely encourage that. And then I'll check in with family members periodically, as long as I have patient's permission, but check in with them periodically to get perspective on how somebody's doing with when it comes to medicines, and when it comes to like remembering to take them and trying to like address if there's some resistance and where that might be coming from. I've been, and also to get the family member's perspective on medicine. Is this person that's coming with them someone that's supportive of them taking medicine, or someone that might not be, that can cause a lot of conflict, I think, for an individual in their own decision making.
Yeah.
About.
So how does confidentiality work in terms of that interaction? Like, do you get the person's permission to talk to their person about their medical?
Yes. I mean, and so sometimes, I would say most of the time, people are pretty open with having me talk to someone in their family about it, and they sign a release of information, and I'm clear about what I'm talking about, that, because in my visits, and I think a lot of adolescent psychiatrists, young adult psychiatrists, we kind of that are not doing just this like really quick med check-ins. That's not how I was trained. That's not how any of us practice, but there's a kind of a period of time in the visit where we are talking about medicines, and then there's kind of the add-on psychotherapy piece. And I'm clear about, like, when I am asking questions to your mom, your dad, your husband, whatever, that this is what I'm wanting to know, and that this is what I'm asking about, and that this is also what I'm not talking about. Like, I'm not talking about the details of your discussions with me about your experiences, but also make it clear that if I'm ever concerned that you're not able to care for yourself well, and that you're not able to keep yourself safe, or that I'm not understanding anything that you're telling me, that I will talk to them and reach out to them because of, concerns about how you're doing.
Right.
Um,
And I would imagine
and
that the patient can talk to you about what they want you to communicate and
right,
what they don't want you to communicate.
for sure,
Yeah.
especially with my teenagers, when it comes to like drug use, when it comes to relationships. And I think every psychiatrist might be different in their threshold of what they deem stuff that they need to talk to families about, or especially parents with minors, and what they, feel like is kind of not emergent. I mean, in my mind, like, it's got to be emergent. Like, if you're out there doing things, if you're 15, you're out there doing things that are going to land you in jail, get you in trouble, like majorly, like, I will tell the patient first before I talk with the family, or even say, like, do you want to talk about it together, or would you rather me talk to them alone? But yeah, definitely letting someone have say when it comes to what things we talk about beyond just like the major safety concerns.
Yeah. Well, these have all been really, really helpful tips. Was there anything else that you wanted to cover, or?
I mean, I'm always curious about the other, perspective on psychiatry and what we can do better or do differently to help people feel more comfortable with their psychiatrist.
Yeah.
So for me, I would love.
I mean, that's a really helpful bit of insight too, in terms of communicating to people watching this that, your psychiatrist wants to understand what you need and wants to help you in whatever your goals are, and so being open and honest about what you need from them and communicating your goals and whatnot are really important.
Mhm.
One thing that we mentioned on this channel is keeping like a symptom tracker, like a journal of, how you're feeling each day, what meds you're on. And is that helpful to bring to a psychiatrist appointment?
Yeah, for sure. And I always, so all of my patients most of them are in weekly therapy, might be going to a group. And I don't want to inundate them with too many things to do
Yeah.
before they come see me. So I kind of make that kind of thing dependent on their personality.
Right. Right.
My one person that has the longest list, like, that's his temperament. Like, I know that he feels more secure with that's how he keeps life in order. So I'm like, this is great. This is how we can work together. I have some people that if I was like, I've tried it. I'm like, it's a sleep diary. And they're like, okay, Dr. Weiss, and it's never going to happen. Like, 'cause they're not going to do that. So I think it's important to start, to be doing a lot of self-reflection in terms of symptoms, but also beyond just symptoms. Like, it's hard to go to school because, I feel uncomfortable around this certain person, where they might not see that as like an anxiety symptom, but just an experience that's challenging, where I can then say, okay, so maybe in my mind, I'm thinking maybe it's a little bit of nervousness, or is this like paranoia? Then we can like further discuss it in order to figure out what it might be or what it might not be, instead of, me making the assumption that perception of a certain experience is going to be anxious or perception of a certain experience is going to be paranoid. Like, I don't know. And I usually don't know in the beginning for a while. And so what I love, and I teach about a lot, is kind of paying attention to your patient's language, and how they experience things. So a symptom might be defined differently by different people, and paying attention to what their language is. Like I had one of my first patients in our first episode clinic. He called, he had a certain word for describing ideas of reference. He called it like trickles.
Okay.
And that's like that's been our barometer of, to tell how that's going. So I think sometimes as long as the checklist, I think, like, captures what is right for them and how they would define something. So I'm not jumping to conclusions that they define anxiety in the same way that as I do.
Right.
If that makes sense.
Yeah, that does make sense. So like encouraging the patient to communicate their experience of what's happening in their own language and whatnot, and working with your psychiatrist to kind of develop that language that you can both work with.
Right.
Yeah.
Before I forget, I was thinking, I have a lot of patients that are referred from inpatient facilities. It's usually the first time they've been inpatient. So in the beginning, definitely having to reassure someone like that my job is to keep you out of there.
Right.
And that you expressing yourself and expressing things that might sound strange to other people, that is not what's going to land you back in the hospital. So you saying something to me, us talking about hallucinations or whatever, like that's not, like, I need to know those things, and that's not going to land you in the hospital, and make it very clear of what kind of hospitalization looks like in my mind.
Right.
If it going to happen, because a lot of people come in very paranoid about just talking to another psychiatrist, because maybe the last two that they saw were in the ER and then in the inpatient unit, and that's traumatizing. And so trying to reassure that this is this is where we this is where we need to talk about these things outside of that setting, and you talking about it doesn't mean, because the last time that they talked about it actually, might have landed them in the hospital.
Yeah.
Kind of establishing that, like, what the goals are in the beginning.
Yeah.
And if your psychiatrist isn't talking to you about what the goals are and it's worrying you, then you should ask, like, what are we doing here? And when would you think I would need to be in the hospital? Like, to try, like, asking questions. Where do you train? What do you like about your job? Like, I like when people are trying to, ask me questions that are going to then help them feel more comfortable.
Yeah. I think that's a really, really important point, because I think that a lot of people, there's trauma around hospitalizations, and it's not a place that you typically want to go. And so that was something that I struggled a lot with, and that was a real barrier to getting proper treatment, was that I was just paralyzed by fear that I was going to be sent to the hospital again. And that if I said the wrong thing, I would just immediately be sent to the hospital. And it took a long time to, build up that trust that my psychiatrist wanted to keep me out of the hospital, because they knew that it was a traumatizing experience for me. And so it took a long time to really understand and build that understanding that we both had the same goals in terms of keeping me out of the hospital, and, being clear with each other what we each thought the threshold was for when I needed to go to the hospital. And, having clear communication about that, so that it wasn't a surprise that, my psychiatrist is like, we need to get you to the hospital. And making sure that it's as clearly communicated as possible.
Yeah. And I think trying to be as explicit about it in the beginning can kind of help. I mean, I assume that when someone's coming in, especially if they're coming in from the hospital setting, that they're going to be paralyzed by fear of like being sick. So don't even, I just assume it and talk about it initially to try to assuage any, I guess, assumptions on my patient's part that's what my role is.
Yeah. Okay. Well, thank you again so much for all the tips that you provided. It's been really, really helpful and insightful and whatnot. So thank you so much again, Ashley, for being a part of this interview.
Welcome. Thank you for having me.
Okay, take care.
All right. Bye-bye.
So really big thank you to Dr. Ashley Weiss for coming and being a part of this interview and sharing her insights and sharing her tips for having a successful psychiatry appointment. I know it was really helpful for me to get the psychiatrist perspective in terms of what is helpful for them in terms of what a patient can do or share or be aware of when they're coming to see a psychiatrist and in a psychiatric appointment, what is helpful. So I thought that was really, really helpful, and I really appreciated some of the insights that she had. I also thought it was really, really great to hear that she was really wanting to know more about what the patient needs as well. And so keeping that in mind in terms of your interaction with your psychiatrist being kind of a two-way street. So working to communicate what you need and also finding out what they might need from you in order to have the most successful appointment possible. So another really big thank you to Ashley for being a part of this interview. And if you have any other tips for what's helped you be successful in your psychiatry appointments, please feel free to leave them in the comments below. If you found this video helpful, make sure to like it and subscribe so as not to miss anything in the future. Thank you again for watching this video, and as always, wishing you and your loved ones good health. See you in the next video. Bye.